start out with Effleurage stroke. Expose your back for a minute. Thing about doing massage, lots of times people put on too much lotion to start with. What you need to do is realize you can always add lotion. So if we were doing Effleurage strokes on the extremities, then in those situations we want to always have our Effleurage pressures directed more towards the core of the body. And the reason for that is because in your appendicular skeleton, you're going to find that your arteries, your vessels, blood vessels, have valves in them that only open in one direction to allow the blood to flow in one direction. So we don't want to go against those valves, so that's why we do it in that way. However, when you get into the torso or the axial skeleton of the body, now we're in a situation where the vessels are running in multiple different directions, so it's not as big a factor. So, but generally speaking, when you're doing an Effleurage stroke, its primary function is two things. One is you're trying to apply an adequate pressure when you're doing the technique that you can see the tissue bulging slightly ahead of you as you perform the stroke, right? We want to do that because we want to fill the capillary beds and move the blood around. Now, sometimes people don't realize, but you're actually, not all your capillaries that have the ability to carry blood actually have blood in them. Sometimes they're just sitting dormant. They don't have really any blood in them. And that's what's actually happening when we're doing like an Effleurage stroke. We're moving the blood from the larger vessels into the capillary beds that have been sitting dormant, right? So that's how the circulatory component works. So again, you can do Effleurage stroke in almost any different way that you want. What you want to do is you want to make the hands, though, relaxed and conform to the body, right? So again, just like any other stroke that you do in the body, what you want to do is a nice long strokes, right? They should be continuous and flowing, not stopping and starting when you do an Effleurage stroke. So nice movements. You can do one side, you can do a hand on both sides. We don't usually have too many clients explode because we've done one side or the other, right? But you're simply just trying to get that blood moving. So the other thing with an Effleurage stroke, quite simply, is what you're trying to do is you're trying to stimulate the superficial mechanoreceptors that are found in the layers of the skin. And by so doing that, we stimulate the nervous system, and that's going to send impulses to the central nervous system, where it synapses in the gray matter and has the ability to release a specialized neurotransmitter, which is called enkephalin. And enkephalin has the ability to reduce pain sensations or actually block pain impulses and create a state of relaxation within the muscle. So that's what we're trying to do. The more we do of Effleurage, the more of those mechanoreceptors we're going to be stimulating and resulting in that outcome. Okay? So that's just a little bit about Effleurage.